SUDEP is sudden unexpected death in epilepsy. It's when someone with epilepsy dies suddenly and we don't know the cause until there's a post-mortem.
In 2011, our son Charlie had a seizure, and 4 days later he had a second seizure, which unfortunately was fatal.
We know that there are at least 21 epilepsy deaths happening each week in the UK, though we suspect that that is underestimated.
So for half the people who have sadly died of SUDEP, it was preventable. Easy steps could have been taken to stop their death.
Epilepsy is a condition that has both health and social consequences. People understand that with seizures there can be injuries, but not a lot of people appreciate that seizures can cause death.
In this world where we need to democratize clinical care, we need to empower patients, and we have the tools for that through mobile phone apps.
The majority of the population has access to smartphones, and particularly the younger age group who are more at risk of SUDEP and death from seizures. So that approach led to the development of EpSMon, which is an app-based risk assessment tool that can be done at any time, not just during a clinical interaction.
So our EpSMon app is a free, award-winning app that any person with epilepsy can download, and it offers them simple yes, no questions all about their epilepsy, their well-being, their seizures, and it helps them to understand what might be a risk for them at that moment in time when they're completing it. We ask people to complete it every 3 months, and it shows them a score, so it puts the information and the power in their hands to really understand what's going on with their condition and what can they do to help make sure that they're living safer with it.
This also helps us understand what people's gaps are in knowledge and help try to raise awareness, and EpSMon also provides data for further research.
We're all moving forward. Technology is moving with us, and for people to take control of their own situation, the EpSMon allows them to do that.
We know that some groups of people with epilepsy may be more at risk than others.
And they are women who are pregnant or shortly after pregnancy.
People living in deprived areas are known to be 3 times more likely to die than their non-deprived counterparts.
It's about 25 times the background risk of the general population.
We also know that people with a learning disability are at increased risk, with deaths due to epilepsy being the second most preventable cause of death among this population.
So people with epilepsy are a vulnerable group.
We wish we knew more about epilepsy before we lost Charlie, and it's sadly taken him losing his life for us to be aware of how important it is to have conversations about epilepsy. We can't change what's happened to us, but what we can do is ensure that by having those conversations, it will save lives.
They must speak openly, and the only way that we can make people aware is to engage with people.
If you're worried about somebody with epilepsy, or you're living with epilepsy, or you suspect a child has epilepsy and it's uncontrolled, please seek medical advice. Use the EpSMon. These tools are all available and they will help save lives without a shadow of a doubt.